Thank you for joining me today. You're in the kitchen today. We're cutting up, and I have a special guest, Lauren Willis. Hello. She's a registered nurse. She's been here before, but we're going to do a series on women's health. We're going to get right into it. We're going to talk about urinary tract infection, UTI. We're going to talk about the thyroid gland, and we're going to talk about depression. And all those foods kind of overlap. And I want you, the viewers, to understand that what you eat can make a difference on either of three of those. So Lauren, can you tell us what our viewers need to really look out for when it comes to urinary tract infection?
For urinary tract infections, also known as bladder infections, it can be really awful for women. It's very painful, very irritating. So there's a lot of foods that we can use to kind of relieve that. Usually with urinary tract infections, they have the bacteria called E. coli, and that's what causes a urinary tract infection. So there are some foods that battle that, such as cranberry juice, and not the kind with sugar because sugar feeds bacteria. So you want to have the type of natural cranberry juice because it causes the actual E. coli bacteria not to stick to the cell wall of the bladder and the urinary tract.
So you're basically telling me if a person drinks 3 ounces of cranberry juice, unsweetened that is,
correct,
daily, they're not getting a urinary tract infection.
Correct. It's been shown in studies that over 80% of people who do intake 3 ounces of cranberry juice daily have less urinary tract infections than the general population who don't, even those who are on antibiotic prophylaxis.
Well, isn't part of the antibiotic made from a
derivative of cranberry juice?
Yes.
Some are. Some are. And even now they're using lactobacilli, which is a probiotic found in like your yogurts and dairy products. It's a natural defender for bacteria and keeps you with your good flora. So those are the bacteria that battle the bad bacteria that are in our bodies.
So what I did a little research, and I mean, you're the expert, and the viewers need to hear it from an expert, but eating fruits and vegetables, I know that orange is more acidic, and then lemon is alkaline. So just know that. And of course, tomatoes is on that list, and carrots, and broccoli, and parsley. Those things help.
Right, vitamin A helps to reduce, and beta carotene, which we find is turned into vitamin A in the body, and that helps to reduce urinary tract infections. One study found that they had a 3.6% rate of urinary tract infections, and after introducing vitamin A into the diet, it reduced all the way down to 0.8.
So people don't even, can you tell everyone what vitamin A is?
Yes, vitamin A is a vitamin found in certain types of vegetables that is part of our makeup that we need on a daily basis.
And that helps convert it to energy, the energy, right?
Correct. It converts into energy. It also helps with eye health and other regulatory processes in the body.
And we have on the table a mango which has A, C, and E. So and it's considered 2 fruits. So if they are eating a mango a day, that really keeps the doctor away, right?
Correct. So it's all about balance, right? We don't want to have our body too acidic. We don't want to have it too alkaline.
So how do you balance that out? Tell me.
So you make sure to have fluids, obviously. You don't want to have too much cranberry juice or too many acidic fruits. You want to make sure to drink lots of water daily.
One of the things that was on our list, blueberries, grapefruit, sweet peppers, which we mentioned, and some of the nutritional blockers that I think a person would need to do is not eat spicy foods, and coffee,
so
right?
When you're, because coffee dehydrates us. You don't want to drink or eat any irritants that may cause irritation to the bladder. Alcohol, because it converts to sugar, and sugar feeds that bacteria. Red meats. They found that red meats contain actually a lot of E. coli. So
absolutely.
When we're ingesting that, we're just introducing that into our
Now,
bodies.
one of the things I was concerned about, strawberries weren't mentioned in my research with urinary tract infection.
Right.
But don't strawberries have a lot of E. coli, depending on where they come from?
Where they come from, correct.
Okay.
So you just have to be very careful. And two, the handling of foods, making sure that you wash all your fruits and vegetables very well before intake.
As a health practitioner, what is the biggest epidemic you've seen that people can avoid if they just would eat right?
Diabetes is probably the largest epidemic in cardiovascular disease, which is sometimes, a lot of times, secondary to diabetes. Another big one, which I know you're going to talk about, is thyroid disease. There's over 27 million people in the world that suffer from thyroid disease.
Now, I did a little research. Now, it turns out that, from my findings, that with the thyroid, people can really control it with food.
Yeah, food plays a big part of it, and it's very important to have a good diet when you have thyroid disease because your thyroid regulates your temperature, it regulates your metabolism of carbohydrates and sugars, it regulates your menstrual period, your blood calcium levels, which has to do with your heart, your weight, and many other things that have to do with your health, your nervous system.
One of the things that I did read was that if you are diagnosed with thyroid disease, then you should immediately get your cholesterol checked because your cholesterol could then infect.
The thyroid regulates our cholesterol levels.
Okay.
So if your thyroid is not working properly,
then
you're going to have high levels of cholesterol.
Uh-huh.
So you have to make sure to get all of those things checked.
So the gorgogenesis, I'm not saying that right, because you can't eat peaches and
peaches and green flower foods. So like broccoli is not good, cabbage is
for
not good.
if you have a thyroid.
Correct, if you have thyroid issues.
So mainly, so you could, I guess there's a test to determine if it's food related once you correct it, or do you have to take medication? Because
Correct.
I find people who are taking medication, they want to get off of it and do the right thing.
So some people have an autoimmune disease, which autoimmune is different. It's a mutation in the body, as opposed to having thyroid disease. And a lot of studies have shown that people who have even some autoimmune disease have deficiencies with vitamin D, they have B12 deficiencies, and other deficiencies with iodine that are found in our foods.
So the iodine, I notice, is one of the things that's on for thyroid.
Correct.
Is that we need in carbohydrates.
Carbohydrates, correct.
Oysters, complex.
Carbohydrates.
Yeah.
Oysters and sardines have high rates of B12.
So that's a trigger?
B12 is a good thing for thyroid.
Yeah. Okay.
Right.
Yeah.
So you want to make sure to eat oyster, sardines, salmon.
Which is the omega-3s are in
Yeah,
those, so you're doing a double thing.
Double whammy for your heart because you're getting the cholesterol levels down as well.
Okay, so viewers, if you guys have any questions whatsoever, feel free to write in. Lauren is going to be our resident health nurse to give us information throughout the year. And we're going to do a series on women's health. And I know we're on a short schedule today, but we have another guest coming up. We're going to talk about depression and how depression really has an effect on the food. Because I know people who suffer from depression. I don't believe it's clinical depression.
Correct, but your foods have a lot to do with your mood. Especially because we can eat foods that release our natural happy chemical, which is serotonin.
I love the happy chemical.
Yes, we have to release the happy chemical. So exercise helps with that, but also with our foods. Walnuts, turkey actually is high in tryptophan.
Right. Walnuts is the brain food, good cholesterol,
Correct.
Everything, right?
Everything,
This is God's gift. We were talking about ancient foods on another show. Okay. We interviewed the author of Makeda, Queen of Sheba, and it was quite interesting. And I would like to bring in Phyllis Thomas. I'm always kidding. Now, Phyllis is our resident diabetes specialist, and she has an MSW and is studied at Stanford, and she's in charge of self-management. And you guys got to listen to her, because if you don't, you're going to be suffering, and you're probably going to get your limbs cut off if you don't.
She's trying to scare you now.
So tell us about, with both of you guys, this is a powerhouse because we really need to stop stressing and being depressed
Well, I'm glad you said the word stress, because stress many times is what leads to depression, holding on to that stress for a long time. But stress affects all of us, right? We get good stress and bad stress. But it's when we let that stress linger on for a long time, and it gives us an emotional response. You were talking about feeling good, those good hormones. Well, stress gives us those bad hormones.
Right.
And a lot of things that happen with stress, when you get the bad hormones, and also you lose sleep, you get headaches.
Well,
There's several things that go along with that.
I'm suffering from a lack of sleep. My brain won't turn off in time, and it's time to get up by the time I'm relaxed.
Well, I'm glad you mentioned relaxation, because I want to talk a little bit about how that can help you and some tools that you can use, because stress, some symptoms, as you just mentioned, lack of sleep, headaches, you have muscle tension a lot of the times, shallow breathing or irregular heartbeat. Sometimes you see your heart speeding up and what's going on with that? Changes in your eating, you're eating too much or you're not eating at all. Or there's also changes in, as you were just mentioning, we talked about sleep, but when you're deprived of sleep, it also can make you angry quick. You can also
and your
get
days
irritated.
confused.
You get irritated quicker, right? So then as you have this deprived sleep, depression can come in. It can come in because of the job. It can come in because you lost a loved one. It can come in because you actually have had a change in your life overall. So we want to make sure if you're feeling tired or fatigued, then you have to step back and say, yes, it's because I'm not sleeping, but why am I not sleeping? Mm-hmm. And what can I do?
Well, I was reading that in my nutritional books that I just study, like the Bible, it says you're not going to sleep until you're able to calm down and relax your mind and your body.
Right. And then there's some other tools I want to give you.
But I thought the doctor said have a glass of red wine, so I'm on my red wine, and that should help me go to sleep.
Yeah,
well, let's
red
talk
wine
about alcohol.
Helps, but theanine that's found in green tea helps a lot, because as opposed to caffeinated teas with caffeine, caffeine causes us to stress. That's how it causes us to be up and awake and all of that stuff. But theanine found in herbal teas and green tea, that helps us to relax, right? So you may have a lot of thoughts going on, but it helps you to relax those thoughts so your body's not stressed. And dark chocolate, actually, it relaxes
And that's
your
an
blood.
antioxidant.
Absolutely. And it's also good for your cardiovascular system because it causes that constriction to release and relax those blood vessels. So it also helps with stress.
Okay. And I want to tell you a little something about alcohol you may not know. A lot of folks feel, okay, the alcohol is going to make me go to sleep. And one of the things we teach
It wakes you up.
in the Freedom 101 Health and Family Development, our chronic disease self-management workshops and our diabetes workshops, because when we ask the brain, we do a brainstorm. Mm-hmm. What are some ways to help you relax? Or what are some ways to reduce stress? Always we might have alcohol. Some people say sex. Some people say exercise. Writing their feelings down, a lot of different things. But when it comes to alcohol, alcohol can actually prevent you from sleeping.
Right.
And a lot of folks don't know that, because it can cause you think it's going to relieve your stress, and now you're up even longer, creating more stress and strain on your body.
And part of the reason for that is the blood sugars. So that's why we like complex carbs and we like proteins, because that helps to regulate our blood sugar levels to help keep it steady throughout the day, so that your mood is steady, your stress levels are steady, because also that regulates your hormones and all those different things. That's why people get hangry.
Yeah, but I wanted to say on the tea, though, I know that green tea has a little caffeine.
Right.
It's green tea, white tea, and black tea, I was told, are the best teas to drink.
Right.
And I know that black tea is fermented and green tea isn't.
Correct. And black tea has a higher caffeine content than green tea does.
Okay, we're running out of time, but I want you to tell us, what kind of foods can we eat to combat depression?
Foods that we can eat to combat depression are complex carbohydrates, so like brown rice, quinoa, oatmeal. Other foods that we can have is foods high in omega-3 fatty acids, because good brain health helps to regulate depression.
And of course, walnuts is in there too.
Walnuts is in there. Your fatty fish like salmon. Dark chocolate is one, so you can have a little treat with the dark chocolate.
And I'm glad you said that, because I was going to ask you, other than the ones that the people who cannot eat fish, what can they eat other than the collard greens, turnip greens, and flaxseed? What would be another choice to get the omega-3 in?
The omega-3s. Nuts is a big one. Another resource for omega-3s.
Fish oil, right?
Fish
Which
oil.
is, yeah.
So you can get the actual pills that have the omega-3 oils in it that you can just ingest. You don't necessarily have to eat the food if you have an allergy or anything to fish. But the best way for our bodies to metabolize it, of course, is a natural resource if you can.
And I just wanted to add one more thing because I would really want viewers to know that depression can become clinical.
Yes.
So if it's lasts 6 months, you're going on 8 months, talk to your provider because there is clinical depression, which does take treatment by a physician. So make sure if it goes beyond 6 months that you are seeking out professional help and that you have tried other tools such as your physical activity, relaxation. We use relaxation tapes. You know, you just get everything kind of pushed away.
But do you do, okay, we're wrapping it up, but look, so in other words, keep off the fast food and processed foods, right?
Processed foods, yes.
Okay, so guys, we're going to have a fantastic second part of our women's health, and I hope you tune in, and we're going to give you all the information you need to make the right step in the right direction for your health. And you have to be a self-manager of your own body, right?
Absolutely.
Okay, thank you for joining me, guys. We've been Cutting Up in the Kitchen with B. Shea. We'll see you next time.
Thanks for having us.
Oh, you're welcome. So, yeah, I am just so excited.